So everyone's probably heard the claim that vaccines cause autism. You've heard those floating around. You probably have questions about them. You hear the term anti-vaxxer used a lot in the news and on social media. And so it's really important to actually look at the data and analyze the data yourself, looking at vaccines and their effect on autism and other safety measures. So that's why we had this assignment for this week, was really to have you guys get used to looking at the data and drawing some of your own conclusions. And being in scientific fields, everyone should always do this. So you should always be looking at the data yourself and drawing your own conclusions from that, even when you do things like read scientific journal articles or look at data that's presented in the news. So what we're going to do in this lecture video is I'm going to talk a little bit about that data that you just looked through for the assignment, and we're going to talk some about how you analyze that data, what you look at, and then why is this so important? So why does this matter for most of you who are going into these health professional fields and who are going to need to know and be able to explain this type of information to the people you're interacting with on a regular basis? So let's go ahead and take a look. Now, while you might hear the term anti-vaxxer thrown around in the news and on social media, that's a little bit of a derogatory term, and if you're talking to someone who is questioning the use of vaccines, it's really not the best terminology to use. And so the official scientific term for this is vaccine hesitancy. So people that might be hesitant about using vaccines or have questions. Vaccine hesitancy is typically caused by three main things. So one is convenience. So people have to have access to vaccines, both cost-wise and availability-wise. Now, if you live in a rural area and the closest clinic is an hour away, is it really going to be a top priority to get all the way over there to get a vaccine? The second is complacency. This has to do with how someone perceives the risk and value of the vaccine or the diseases. And so this is often what you hear when you have people say, I don't ever get the flu, I don't need the flu vaccine. To them, the risk reward is just too low. And so they're complacent about it. If they don't see getting the flu as a risk, they're not going to bother to go and get the flu vaccine. And then the third one is confidence. And this is really the one we're going to talk about. This is the one that you see a lot in kind of the news and the media and that you hear talked about. This is trust in the safety of vaccines or the effectiveness of them. So do they even work and are they safe to use? And also trust in the system that delivers them. So can you trust the nurses and doctors that are telling you what these are? The biggest argument here is that vaccines are associated with autism, the one that you hear all the time. But there's also confidence in what's in the vaccine, so the contents themselves. So thimerosal is an ethyl mercury-based preservative. It's used in kind of multi-use vaccines, so it's a preservative. It keeps them sterile. Multi-use vaccines are when you have to go into the same vial to do your different vaccines for different people. You want to keep that vial sterile. There was concern because this is mercury-based, but it is not the methyl mercury that we hear about as a problem that builds up in tissues. Ethyl mercury does function differently in the body. But the other thing is that thimerosal is not really a concern anymore because it hasn't been used in any of these vaccines since 2001. About the only vaccine it's still used in is some of the influenza vaccines, but some of them don't have it. And then there's concerns about things like aluminum or other adjuvants being in vaccines, and do they cause problems? And then just overall, does the vaccine cause the disease? What are the side effects? And we mentioned in the actual lecture video, there are side effects with some vaccines, just like they are with every other drug that you take, but those are not the same concerns as things like being associated with autism. So the first study I had you look at was this study that was linking the MMR vaccine to autism. Remember, looked at 12 different children, so you can see the children listed here. Most of these children had a behavioral diagnosis of autism, and then pretty much what the study was is this diagnosis associated with some sort of exposure? And so they asked pretty much the parents, and they said, okay, what things were going on around the same time that you found out and the behavioral changes you started noticing for autism? And so you can see the exposures here. Many of them indicated the MMR vaccine. One indicated recurrent ear infections were happening around the same time. And then they said, okay, well, how close were those things together? And you can see that a lot of them were 1 to 2 weeks. A couple of them were in a day or two. And the rest of these data was what other things were they noticing? So what features were they associating with this kind of exposure. And these are things like the repetitive behaviors, the self-injury that are part of the autism diagnosis to begin with. This last one wanted to know, when was the actual behavior showing? What we didn't have you look at in the actual assignment was the fact that this study also looked at the bowel. So they also did colonoscopies and looked at the gastrointestinal system of these patients, mainly because there's also been a lot of connections between having GI problems and autism. When you looked through this data, there's a couple of things you should have noted. So one, this was a study of 12 people. And when you look at these types of studies, you really have to think about sample size and how relevant are the conclusions based on a very small sample size. Oftentimes, studies will start with a small sample size. If they find something interesting, they need to repeat it in larger groups of people to really show that this just wasn't by chance and that this really is a significant finding. So 12 people is a pretty small study. The other thing that's important to note here is that just because there seems to be a connection between the MMR vaccine and this diagnosis of autism, because they're happening around the same time, does not mean that that's a causative connection. So there's a big difference between causation and correlation. Just because two things happen at the same time, they correlate, does not mean that one is actually causing the other. Now, the reason you have to be careful of studies that say a correlation is tied to causing something is because of something called spurious correlations. So for example, did you know that your chance of drowning increases when you eat ice cream? So ice cream causes drownings. And we can see that in the graph here because as ice cream sales are increasing, so the more ice cream people are eating, the more chance they have of drowning. We see the drowning increasing at the same time in the orange line. But when people stop eating ice cream, then they're safer. They're not going to drown as often. Or did you know that people in Maine who get divorced tend to eat a lot of margarine? And so we can see in this graph here, as the divorce rate is falling, the amount of margarine being consumed is also falling because less people are getting divorced, so they're not eating margarine as much. Okay, so these are spurious correlations. There really is no connection whatsoever between divorce and eating margarine. It just happens that the data in those lines are following a similar trend. In some cases, that trend is similar between two sets of data because they're associated with some other factor. So for example, the ice cream and the drowning. If you notice the months along the bottom, the ice cream sales are increasing in the summer when it's warm, when most people are out eating ice cream, and the drowning is increasing in the summer when it's warm and people are out swimming. So it's not that the ice cream is causing drownings, it's that both of these things happen in the summertime, and so their rates go up in the summer and they fall in the winter. Okay. This is why whenever you have correlations, you need to look to see, is it likely that there's a causative connection between those two things? Or is there something else that could be associated? And so with that autism study, with only 12 patients, you're probably going to need to do larger studies to see if that correlation is truly causative or it's just correlating because of something else. In this case, it tends to be that the symptoms of autistic behavior tend to manifest around the same age that you actually get the MMR vaccine. So it's not necessarily that they are connected, it's just that the time that autism symptoms show up in children tends to be around the same time that in the vaccine schedule you're getting the MMR vaccine. The other study I had you take a look at was a much larger study. So you should have noticed that there were a lot more children in this study, which means that when we get data back, we can say that it's probably more relevant to the larger population as a whole. I do want to point out that the study was done in Denmark. A lot of these studies are actually done in some of the European countries because they have universal health care. And so universal health care means all of the medical records are in one system. So it's actually pretty easy to go into the records, pull all of the data to do your studies. That's pretty much impossible to do in this country because every individual hospital system has its own separate data. So there's really no way to go in and pull all the data for the country as a whole. When they did in this study was they took all of the children and they went through the records to say, okay, how many of them had received the MMR vaccine, and they put them into the yes, they had been vaccinated group, and how many of them had not. Okay, they put them into the no group. Now they used person years instead of just how many people were in each group, mainly because the children were different ages, and so they wanted to control for that. So example, someone who might be 5 when they were vaccinated versus someone who was 1. They wanted to control that. So that's what the person years is. And then all they did was look to say, okay, how many people actually got diagnosed with autism or autism spectrum disorders in the vaccine group compared to the group that did not have vaccines? Because if there is a causative association between the exposure, which in this case was the vaccine, and the disease, you would expect to see a higher number of people with autism in the vaccination group compared to those that were not. And we calculate these risk factors with something called the relative risk, which is really telling you if you got a vaccine, how many more times likely are you to then develop autism? And if you notice from the data, the relative risk for autism was 0.92. That for your autism spectrum disorders was 0.83. Both of those are slightly below 1. So when you're below 1, the association is actually protective instead of causative. But the key to point out and to notice is what the CI is. Okay, so the CI is your confidence interval. This is telling you how confident are you in your data. So one number is not really giving you a good view. That number likely ranges somewhere between this interval. And if you notice in both cases here, that interval crosses 1. So we go from 1.07, a number larger than 1, to 0.65, a number lower than 1. When your confidence interval spans 1, this is really saying there is no association at all. So vaccines are not causing autism. They also are not protecting you from autism. There's just no causative link between the two at all. This study is called a cohort study, and we're going to learn about cohort studies and kind of why we do them when we talk about the epidemiology chapter. I wanted to point out data from another study that was done very similarly. This isn't one you've already looked at, but this one was looking at, instead of the MMR vaccine, the connection between thimerosal, so that ethyl mercury based substance that used to be found in vaccines, and these developmental disorders. And so they did something similar, but instead of grouping children based on whether they received a vaccine or not, they grouped them whether they received vaccines that were all thimerosal free or whether they had gotten any that had thimerosal. They then did that same comparison. How many people had autism in each group and how many people got diagnosed with other autism spectrum disorders? And if you look at the relative risks here, okay, you'll see that when we look at those confidence intervals, again, there is no association between thimerosal and the risk of developing autism. They broke it down even more to look at dose. So if you just get a little bit of thimerosal versus a lot, did that change anything? And when we look at the overall numbers, the answer is no. So there is no connection between the MMR vaccine and autism. There's also no connection between thimerosal and autism. And these types of studies have been done repeatedly now with large bodies of evidence pointing to no connection between vaccines and the development of autism. Okay, so I do this assignment this way because I want you guys to get used to looking at data and coming up with your own conclusions, actually processing through that data yourself. So if we go back to this original set of 12 individuals, you should be able to look at this now and say, okay, this is a study that's showing a correlation, right? The MMR vaccine was given, and around the same time, there were differences in behavior in these children, and they were being diagnosed with autism. But 12 individuals is a relatively small sample size, so maybe we shouldn't say that this is a causative connection right now. Maybe we need to do more studies and larger studies to see if this correlation is actually the MMR vaccine causing autism, or if it was just a spuritive correlation. I do this data this way so that you recognize that this set of 12 really doesn't show a causative link, because this is the key set of data that set off a large part of this anti-vaccine movement. So this data is what the press point to to say that the MMR vaccine causes autism and is really what led to this whole concept of vaccine hesitancy. The other thing about this data is even if it was good data, it does not show that causative link, but it's not even good data. If you actually look up the article that data came from, this is what you're going to find. So that article has been retracted because nobody could repeat the study. And Andrew Wakefield, the leading author on that paper, has also had a lot of other problems associated with this. This article had been published in 1998, but by 2004, no one had been able to reproduce the results. And then a report came out that Wakefield actually had undisclosed financial interests. So he was actually being paid by lawyers from a group that was trying to sue vaccine companies. And so you often hear about, doctors or pharmaceutical companies are making money and not telling you everything. In this case, it was the actual researcher who was getting paid by lawyers who wanted to sue the vaccine companies. And so it was beneficial for him to be able to say that some sort of vaccines were bad. In 2004, because of some of this, 10 of the 12 authors on the paper retracted their findings and said, there was a mistake in this publication. And then the journal itself retracted it in 2010. Even more concerning, though, was it came out that Wakefield did this research without actual approval by the Ethics Review Board. So you can't do human subjects research unless you get approval from what's called an IRB, or an Ethics Review Board that looks at what you're going to do with people and says, yes, this is an ethically sound study. He never got that approval, and he was working with children, which is a really big deal. He was also found guilty of deliberate fraud because of those undisclosed financial issues, but also because it turns out that some of the data that he presented was actually made up. So when you go back to the records and of the patients, a lot of it doesn't line up. You can see it in the table where some things were reported in the article that they can't find in the actual records of these patients. So this is a problem. And what happened in 2010 is that the British General Medical Council found Andrew Wakefield guilty on 4 counts of dishonest behavior and 12 counts of abusing developmentally delayed children because of the non-ethical review board study that he had done. And he was actually barred from practicing medicine in the United Kingdom. So he can no longer practice medicine as an MD, but he is still around. He is still talking about how vaccines are bad. And this is why I have you guys look at the data, because not only did the data not say that there was a causative connection, the data itself have actually been retracted from the article in general, and there were all sorts of ethical problems behind the study to begin with. So why does this all matter? We've seen a decrease in the percentage of people getting the MMR vaccine, which protects you against measles. So before vaccination against measles started, which was in 1963, there were about 3 to 4 million cases of measles just in the United States every single year. About 500,000 of them were probably reported to the CDC. They led to about 48,000 hospitalizations and about 500 deaths. So luckily, measles is not a disease that is super virulent. Okay? It's not going to kill a large number of people. However, it does lead to blindness in some individuals. And the concerning thing about the measles virus is that it has an R0 of 12 to 18. We've heard R0 floating around when you'd hear about COVID-19 these days. That's the number of people you're probably going to spread it to if you have it. So someone with measles will actually spread it to anywhere between 12 and 18 other people while they are infectious. This is one of the most infectious diseases that we know, and so it spreads very, very easily. To put it into perspective, influenza has an R0 of about 2 to 3, and it's looking like coronavirus is probably going to be somewhere in that same range. But since we've had a vaccine, we've had about a 99% decrease in measles cases. And the US is technically considered measles-free still because most of our outbreaks have been from people coming into the country with measles and then spreading it in the populations here. So I do this lecture this way because many of you are going to become health professionals. You're going to be interacting with patients on a regular basis. And a lot of you have family here and you want to stay in the area. And for Utah, vaccine hesitancy is now a huge problem. We're starting to see articles like this one, and this one, and this one, highlighting the fact that Utah is having a very low vaccination rate in infants. In fact, if we look at the data in Utah, so this is data from 2016 and 2017. We're seeing both Utah here and the United States. And we want to look at the MMR vaccine. So in the United States, about 91 to 92% of the population is vaccinated. For measles, because it is so contagious, to be able to have herd immunity, you have to be at least above 90%. We'd really prefer it to be closer to 93 to 95%. But if we're over 90%, we should have herd immunity in the population. Notice that Utah in 2016 and 2017 was right around 88%, so just under that 90% mark we want to be hitting. This data is a couple years old because most public health data isn't reported for a year or two out because it takes time to collect it. And so at that time, so in 2017, we were ranked 45th out of all the states for our vaccination rates. But when you look specifically in Utah County around us, you find that the story is even worse. So remember, Utah State has an MMR rate of about 88%. The United States had a rate of about 91%. And if we look at the rate of MMR in Utah County, and again, this is for 2017, we were at 82.6%. That is pretty much a measles outbreak waiting to happen. And in fact, in 2015, we almost did have an outbreak in Utah County for measles. There were 2 teens who had gone to Disneyland and actually contracted measles while they were there, and then brought it home to Utah County. Before they were diagnosed with measles, they had gone to the movies, they had gone to buy groceries, and they had gone to church before they ended up in the Timpanogos ER. During that time, they luckily infected only one other child. Remember, the R0 of measles is 12 to 18. So they got very lucky that they hadn't spread it to more people, some of which is based on the fact that at least some people are vaccinated, especially older individuals. Most of them are going to be vaccinated kind of before this vaccine hesitancy thing had started. But they did expose 117 people to the measles virus, and those 117 people had to spend 21 days in voluntary quarantine. You guys are kind of used to voluntary quarantine now with COVID-19, so you have a sense of what that means. At the same time, this cost the state and county health departments $115,000 to contain. That's the cost of doing the contact tracing and the follow-up to actually figure out who their contacts were and have them do voluntary quarantine. And that was all for just 2 people. And so imagine what this would cost and how this could spread if there really was a true measles outbreak now that we're at 82% vaccine rate in infants and children in Utah County. There's actually a way you can model that. I'm going to run it for you now. Throughout a community based on the level of vaccination rates. And so you can specifically select the community you want to look at. So we can say we want to look in Utah and we want to look around us. So we want to look at Orem. And then what we're going to see down here is, here's our area of the map we're going to be looking at. You're going to see dots appearing. The red dots are going to be active cases of measles. The blue dots are people who got measles and then recovered. And so what we'll be looking at is what happens if a couple of people end up coming into the community who have active measles, but we have a 95% vaccination rate. Remember, that's giving us herd immunity. Versus what happens if a couple of people come into the community with measles and we do not have herd immunity. And so this is showing an 80% vaccination rate. And keep in mind, that's not that far off from where we actually are. So let's restart these and see what happens. Notice we get a little bit of spread here, but notice all the cases that are showing up as we go forward. This is the difference between having herd immunity and having no herd immunity in the populations.